And as you heard, he's an emergency medicine doctor, and he works in the White Plains Emergency Department. But more than that, he was in New Orleans. He was there after Katrina. He's traveled to Pakistan, around the world, to serve people. So I give you Erik Larson.
Woo! Hi, it's great to see everyone out here. I think the first thing we all realize is that the importance of health care, all you need to do is just get a little cold. When you get a little cold, all of a sudden you start to realize everything else becomes secondary, okay? When you start to feel sick, everything else falls by the wayside. When you start to watch your kids or your parents or your friends get sick, everything becomes, the most important thing is getting them healthy. In the emergency department, we form the front lines of sort of health care in America today because we are the final safety net. If people get sick, if people get injured, they come to the emergency department, okay? We cannot, a law was passed that we cannot refuse care to anyone, and that was a great law. But the point is that someone is going to pay for that emergency care, and that's why we need emergency care, universal care for everyone, for all of their health, because a lot of people land up in the emergency department because they let a minor condition become a major catastrophe, because their untreated high blood pressure and hypertension became a stroke or a cardiac event, because their high blood sugar became a diabetic crisis, they land up in the emergency department. There's also an illusion out there that a lot of people come there just for primary care, and that's why the emergency departments are so overcrowded. Well, that's true in a way, because they have no primary care. And when they get there, it is a true emergency. Really, only about 15% of the patients that we see aren't a so-called emergency, because what's happening is America is getting sicker, and the sicker are coming to the emergency departments. So what we need is a good, well-organized system of family practitioners out there, of people who take care of people on a daily basis, of health clinics that take care of people on a daily basis, where basically what you can do is walk in there with your problem, and the only transaction that you have to make is that you pull out a card that says, this is who I am, I'm an American, I need health care, and that's it. And you get taken care of. And you don't wait until it gets so bad that you have to come to the emergency department. So, you know, look, people resisted this whole concept of Medicare many years ago, including many of my fellow doctors in the AMA, who said it was a socialist plot, who said it was the end of health care. But then what happened was, when it got instituted, many doctors realized that it was a great thing, that they didn't have to worry about whether their patients could pay or not pay. Okay? They would come and they would take care of the patient. That's what we're supposed to do. We're not supposed to have a whole staff that just deals with insurance papers. We're supposed to have a whole staff that takes care of people. So, in closing, I just want to say, for doctors, for patients, for nurses, for all of us in the healthcare industry, but especially for all of the people, whether they're here or in the entire world, healthcare is a right. Healthcare is just a basic human thing. Yes. Are we going to deny anyone that? No, we can't. Okay? And so we must continue the struggle. We must win some type of universal health care system. Everyone will be happier with it. Everybody in, nobody out.